Hello everyone, and welcome to our webinar on cash first approaches, reducing the need for food banks in Glasgow. It's great to see so many people join us today. You're very welcome. Today's session is brought to you by the Glasgow Fair Food for All Partnership, which is part of the Glasgow Food Policy Partnership, and we're collaborating with and supported by the Glasgow Centre for Population Health. My name is Jill Murray. I'm a Public Health Programme Manager at the Glasgow Centre for Population Health, and I also chair the Glasgow Food Policy Partnership, which is a multi-agency partnership in Glasgow which supports the delivery of the Glasgow City Food Plan. Before we start, I just want to let you know that today's webinar is being recorded, and we will circulate the link to that recording after today's event. You'll also be able to access the link through the Glasgow Food Policy Partnership website, along with the other GFPP webinars, and on the Glasgow Centre for Population Health website, along with other GCPH webinars. You may have noticed that this week is Challenge Poverty Week, and that today's theme is food, and more specifically about moving towards a Scotland that is free from hunger. Today's webinar ties very much into that theme, and I'd encourage you to take a look at Challenge Poverty Week's policy briefing number 4, titled A Scotland Where We Live Without Hunger, which is published on the Poverty Alliance website. Food poverty can be defined and measured in many different ways. The terms food insecurity and food poverty are often used interchangeably, and we'll do the same for the purposes of today's webinar. Public Health Scotland defines food poverty as the inability to acquire or consume an adequate or sufficient quantity of food in socially acceptable ways, or the uncertainty that one will be able to do so. The Scottish Government describes food insecurity as a lack of access to adequate or appropriate food due to a lack of resources. According to Greater Glasgow and Clyde's Health and Wellbeing Survey, the proportion of people in Glasgow City who reported experiencing food insecurity doubled from 11% in 2017-18 to 22% in 22-23. In the areas of greatest deprivation, this was as high as 30%. Last year, Trussell provided the highest number of food parcels in Scotland ever, even higher than during COVID. Of course, food insecurity is just one manifestation of poverty, and we know that poverty affects many people in Glasgow. It's estimated that over a third of children in Glasgow lived in poverty last year. Food poverty has negative health and economic outcomes, as well as social and psychological impacts. And we know that dietary-related illnesses disproportionately affect those living in poverty, because it's so much harder to eat a nutritionally balanced diet when money is scarce. The Glasgow City Food Plan is a 10-year plan launched in 2021, which recognises the interconnected nature of the problems arising from our current food system. These problems include food insecurity and dietary illness. The plan aims to build a food system in Glasgow that is fair, resilient, and environmentally sustainable, and enables everyone in Glasgow to eat healthy, affordable, culturally appropriate good food, irrespective of where they live, their income, or their personal circumstances. The food plan was developed by the cross-sectoral Glasgow Food Policy Partnership, which is a collaboration of 23 public, private and third sector organisations. The partnership knows that we can achieve much more when we work together, support each other and collaborate across all our sectors, communities and the food system. Scottish Government's strategy to end the need for food banks is rooted in a cash-first approach. Glasgow is taking forward one of the 8 cash-first projects funded through this strategy, and the Glasgow Cash First project is being led by the Fair Food for All Partnership, which is part of the City Food Plan delivery. You'll hear more about the Glasgow Cash First project today. We hope that today's webinar will provide you with more information and understanding about the work underway in Glasgow to build cash first approaches into support for those in crisis. If you work with people affected by food poverty, we hope the information today will help you in that work. We have three presentations today, followed by a Q&A session. We start with a description of cash first approaches and an outline of the Scottish Government Cash First project currently underway in Glasgow. Then we have a summary of the cash first approaches that are already in place in Glasgow. And the last presentation of today's session gives a summary of financial inclusion services that are already embedded in communities. If you have any questions for our speakers today, please use the Q&A function only. We will do our best to get all your questions answered, but given our time limitations today, we might not be able to answer them all. If we don't, we will follow up with an email. Our events team will be using the chat function to post links that are relevant to the presentations. So I hope you enjoyed today's presentations. I'm now pleased to introduce our first speaker, Faiza Handrad Jackson. Faiza is a public health practitioner specialist from the Glasgow Centre for Population Health and is the project lead for our Glasgow Cash First project. Faiza's background is in public health, health promotion, and the management and control of infectious disease. And prior to this role, she was an epidemiologist and healthcare scientist at Public Health Scotland, working on antimicrobial resistance and infection control, gastrointestinal diseases and zoonoses, and was part of Scotland's public health response to the COVID-19 pandemic. Faiza is going to talk to us today about cash first approaches and how they can be used to tackle food insecurity, as well as giving us a bit more information about the Cash First project in Glasgow. So without further ado, I'll pass on to Faiza now. Thank you.
Morning, everyone. I hope you can hear me okay. If there's any issues, please do let me know. So I'm here to give you a little bit of a summary about cash first approaches in Glasgow. So I'll start off with what is a cash first approach. So there's, as Jill mentioned, there's lots of definitions about food insecurity, but cash first is broadly in two parts. So the one part is to deal with the immediate crisis. So if people can't afford food, a cash-first approach tries to take a holistic human rights approach to tackling food insecurity in terms of, so that can be cash, for example, a Scottish Welfare Fund crisis grant, or vouchers so that people can choose appropriate, nutritious, and culturally appropriate food for themselves and their families, because people know what they need. This aims to give people dignity, choice, and agency. Now, I've listed I've included pictures here with definitions from the Scottish Government Cash First plan, which Jill mentioned, towards ending the need for food banks in Scotland. And it clearly says that the second part is about preventing future crises by providing access to advice and support. Now, these advice and support services will be covered by the speakers after me, and they'll tell you about some of these services in Glasgow and how they're embedded in the communities that they serve. My lovely colleagues at GCPH have put together this nice concept explainer about cash first approaches, which you can find on their LinkedIn and their X pages, formerly Twitter X pages. So essentially, it's just trying to break it down into some useful, hopefully simple language that you can use with your colleagues, with the people that you work with. So it's about a whole bunch of different interventions. It's trying to increase engagement with low-income communities, and it should help to address malnutrition and poverty more effectively. Food insecurity affects all aspects of people's lives, and the whole point of cash first approaches is to give people a way to address immediate needs, but also contribute to their long-term well-being and resilience. As I mentioned already, the core of cash first approaches is respect for autonomy and dignity. And this strategy aims to prevent problems, fostering empowerment and community. Now on to the Cash First pilot project. So as Jill mentioned, there are 8 of these across Scotland, funded by Scottish Government, for 2 years and with the following aims, which are listed on there. But the other thing I was going to mention is that although we're funded for a 2-year period, we're already 6 months into this. And we're trying to work out what works in the different contexts. All of the Cash First projects are in either urban, rural, or island populations across Scotland, working in partnership with local authorities, the NHS, health and social care partnerships, and third sector organisations, and each of them is taking a different approach in line with their context, with the aim to tackle food insecurity collaboratively and in partnership, to test different approaches of tackling food insecurity, the aim to learn more about what works in these different contexts and collect best practice, and crucially to promote well-being through community food. So I mentioned partnerships. This is a list of some of the partners that we have as part of the Fair Food for All partnership with which Jill mentioned earlier. As you can see, there's a lot of organisations listed here, and this isn't all of them. This is a subset to kind of give you a bit of an idea that it covers various parts of Glasgow City Council, NHS, Greater Glasgow and Clyde, Glasgow City Health and Social Care Partnership. We've got Glasgow-based initiatives such as Glasgow Helps and No Wrong Door. Of course, we work with Trussell, Independent Food Aid Network, Scottish Pantry Network, Glasgow Community Food Network, food banks and pantries across Glasgow, etc. It's important to have everyone involved in all of this work, because our main objectives are to work in partnership with all of these organisations. We're trying to use data to guide our approaches. So part of that is identifying the data that's being collected across Glasgow and working together to analyse the data and understand what it shows us in terms of the landscape of food insecurity, who it affects and why. We're also trying to carry out some research to better understand the reasons why people need emergency food aid so that we can provide more appropriate support. Now, Leslie is going to be talking to you next, and she'll mention some of the tests of change that Glasgow City Council are carrying out. And we're also carrying out small tests of change so that we can all identify new approaches to tackling food insecurity. We're working in partnership to identify any gaps in services, and these can be addressed in future work. And part of our objective is to facilitate training and materials such as this webinar, for example. So there are more sessions in the pipeline, and we'll share the links to those during this webinar. And now to the important bit that I wanted to stress to everyone, because it's important to know that Glasgow's Cash First project is not giving out cash to people. It has the reason for that is that it's a pilot project. It's got short timescales and limited funding. So our focus is on improving the partnership working, connecting people with existing services, and working collaboratively to ensure that there's a consistent approach and referral pathway for everyone accessing services. Thank you so much for listening, and I'll hand back to Jill. If you have any questions for me or any of the other speakers, please pop them in the Q&A box and they'll be answered after the presentations. We'll do our best anyway. And my email address is below. Please feel free to get in touch if you have any questions. Thank you.
Thanks so much, Faiza. That was great. Our next presentation comes from Leslie Haddle, who's going to provide more information about the range of cash first approaches across Glasgow. Leslie is a strategic lead in Glasgow City Council Financial Inclusion and Transformation team. With a background in welfare benefits, Leslie's role is to develop test of change opportunities aimed at eradicating poverty. It's therefore important for her to understand how the changes made at national level will impact on families across Glasgow. She's keen to play a part in developing cash first alternatives to food inequality, specifically through tackling poverty at the earliest opportunity in a citizen's life. And Leslie's also very involved in the Cash First project that we're taking forward in Glasgow that Faiza spoke about. So over to you, Leslie. Thank you.
Thanks, Jill. Thanks for the introduction. Leslie Haddle, and as Jill had said, I'm the strategic lead within Glasgow City Council's Financial Inclusion and Transformation team. Just to reflect on what Faiza had mentioned there, you know, my role has been more to develop projects that are maybe an earlier intervention so that our citizens, many of our citizens won't need to seek the services, you know, of food banks, etc. in the city. They're still very much up and running, these tests of change, and it's certainly opportunities that your organisations should be aware of and as referral pathways. So I'm going to speak to you today then about 3 specific projects, one being the Pensioner Poverty Project, one being the Financial Inclusion Support Officers in Schools Project, and one being the Child Poverty Pathfinder, which many of you may already have heard about through the No Wrong Door sessions that have been operating across the city this week. So I'll start with pensioner poverty. The full title of the initiative is the Pensioner Welfare Advice and Support Project. And the background to that project was, as many of you will already be aware, there's many underclaimed benefits in the UK, and predominantly the largest underclaimed benefit is for the elderly population, and the national figure estimates up to 1.7 billion remains underclaimed every year in pension age benefits. So there's multiple reasons for that, one being stigma. My personal experience of that is a lot of our older population are very proud people and also don't like speaking about their financial affairs, and that really makes up to this underclaiming figure. So the approach that we took a targeted approach. So we actually used the housing benefit and council tax reduction data available to Glasgow City Council, and that actually allows us to understand who in the city is eligible for benefits, predominantly attendance allowance and pension credit, but is not claiming those benefits. Now, an advice from other projects and other colleagues that deliver similar services, we took an opt-out approach. So what we mean by that is, rather than writing out and maybe with a flyer and offering people a service, we actually wrote out to our citizens and said, Leslie's going to be coming out and speaking to you, has an appointment with you on Tuesday at 10 AM. If you do not want this service, contact us and opt out of the service. And we felt that really benefits in terms of take-up. We used a partnership approach because we do recognise that not all our citizens want to speak to Glasgow City Council about their affairs. So we reached out to partner organisations across the third sector. Predominantly that was Glasgow's Golden Generation and the RSL network. So the Wheatley Group were a key partner as well. And what that resulted in was a welfare rights visit, and it was a home visit. So we offered everybody that home visit appointment, and a welfare rights visitor came out, went through your claim with you, and also gathered that information from you, the evidence that you would require to support your claim, and seen that claim right through to the end. What that resulted in was some really positive outcomes. So in 23-24 alone, we have contacted 1,656 clients, completed 911 benefit checks. So the drop-off there is the people that actually did opt out of the service. Those clients had 466 financial gains, and those financial gains amounted to 2.7 million. Now, these are not assumed financial gains, they're actual financial gains, so we don't count them until we've verified that the clients received this money. And that actually resulted in an average financial gain per person of £5,756 per year, and that's obviously ongoing from now on. So it is significant financial gains. That's why it makes this service so worthwhile. The impact to date from the service is that there's been 1,300 clients taking up the service that have received financial gains, and the total financial gains are 6.8 million across the city. So hopefully that gives you a flavour of the underclaiming in this client group. It's also really important to us that we also gain client feedback, and what probably plays more into the space of use of food banks and emergency food aid is that 92% of the respondents were unaware of the benefits that they were entitled to before we contacted them. But 100% of the respondents said that the service had had a positive impact on their financial position. As I said, the project's still ongoing, and it's very timely that I've had this opportunity to come and speak to you all, because you'll have heard in the press about the winter fuel payment changes, and it seems to be changing every day, the government's approach to this. But as it stands as today, you're only going to qualify for the winter fuel payment if you're in receipt of pension credit. Now, today, the project's predominantly targeted people aged over 80 plus, and we've dropped that down to over 75 plus. As of this week, we're going to be writing out to all our citizens aged 67 plus, so pension age, to notify them that they would be eligible to claim pension credit but are not claiming. And we're also going to offer support to people making a claim. The window for this is really short. We've got to get the claims made by later on in December to allow for a back date, and that in turn will qualify you for the winter fuel payment. So some quite significant work to be done over the next few months, and we will be targeting 6,000 of our citizens to make that offer of support. So again, something that we would encourage any of your organisations, for service users that are coming in that are of pension age that may appear to be struggling financially, to take up that service. The next project I wanted to bring to your attention was our Financial Inclusion Support Officers in Schools project. Now, the background to that was, again, taking service user opinion on board. We'd been working, I'm actually in the Carlton today, working from GCPH's offices, but we'd actually worked with a group of parents in the Carlton group, and they'd said they predominantly do not access mainstream financial inclusion services. There's a number of factors, you know, they may have small children, don't want to present to drop-ins due to waiting times. There's a number of factors. I also work with colleagues that are on the meeting today, you know, from Money Matters and the wider financial inclusion network across the city about the mainstream services. So we already knew that parents with dependent children weren't accessing those services as much as single people were. So we listened to those service users, and we also again used that data available to the council and seen that there was underclaiming, although there was entitlement there, of council in terms of council tax and housing benefit of free school meals, school clothing grant and education maintenance allowance. So on the back of that, took a similar approach to pensioner poverty. We got some welfare rights officers on board. They were again all from the third sector, GMAP, Money Matters and a group of the Citizens Advice Bureaus in the city. And this project is actually delivered through our schools because we've seen that as a good way of engaging with our parents, probably on the back of the pandemic. The schools, you know, were really key in reaching out to our citizens, and we do that not through just a letter drop, but also using that technology that's probably ramped up during the pandemic, social media, etc., to increase that customer engagement. The outcomes and outputs from that project, again, have been really significant. There's been nearly 4,000 clients access the service. Of those clients, that's made up of 6,500 children. There has been 2,383 financial gains to date, and those total financial gains come to 7.5 million. Again, these are actual financial gains, not assumed. And what we understand from that is that that's broken down a bit further. Those financial gains come from 76% underclaiming of, you know, social security benefits. So again, that's putting money in people's pockets on an ongoing basis. But also there's been cost of living supports provided in terms of those financial gains by our welfare rights officers. That's such as, you know, maybe fuel top-ups and also access to pantry services through our Glasgow Health team that my colleague Audrey is going to speak to you about in a moment. Client feedback again here has been really important to us. 92.5% have said they're really satisfied with the service. But again, jumping to the point that it may stop some of these service users accessing emergency food support is that 79.2% said they were less worried about money concerns after seeking advice and support from the FISO service. So where the project is now, it was predominantly, you know, set up as a financial inclusion service, but we've enhanced that and it now provides employability support as well for access to training and education to help some of our parents start their careers and move on to better paid employment. We continue to offer advice around fuel supports, that's fuel advice or fuel top-ups. We've been victims of our own success to a certain extent because we thought, you know, we'll start in the secondary schools with those 9 FISOs, we'll exhaust there and move on to primary schools, but the demand for this service has just kept going. It could be a result, you know, of cost of living crisis or other changes to some of our parents' status during the last few years, but the service is still up and running. And we might take a potentially different approach next year and do something even more targeted about that underclaiming of free school meals and school clothing grants and EMA, just to make sure that that money is going in our parents' pockets. The last thing that I wanted to speak to you about was the Glasgow's Child Poverty Programme. As I said, you may have heard about this already through attending No Wrong Door events that have been operating across the city, not just this week, but over the past few months. The project emerged as a result of the Child Poverty Act, and you'll be aware from that Child Poverty Act, the figures for Glasgow are, you know, they're significantly high. highest in Scotland. It's not something that we're proud of, but it's certainly something that we want to tackle head on in our approach. So once those figures from the Scottish Government figures in the Child Poverty Act were published, we wanted to look at that in a bit more depth, and that's where the Child Poverty Report was published firstly in 2020, and that looked at individual client data again in the city in a bit more detail to understand underclaiming, geographics and demographics of those client groups. It just wasn't really coming out from those Scottish Government figures. So from that, you'll maybe have already been invited to a session on the Child Poverty Dashboard. So this is where we've had some very techie, clever people that have made this report more interactive and produced it into a dashboard. And there'll be links to that available as a result of Challenge Poverty Week for anybody who wants to access that information. From that, we realised in Glasgow we had to do something quite different, because although we've all been working really hard in tackling child poverty to date, it maybe just wasn't having the impact that we'd hoped for. So we want to take a really innovative approach to this, again continuing to use data science. We always want to, listen to the service users' views and things, so that's where we use storytelling and illustration to help us design those services. What we couldn't do is, we couldn't do this alone, though. It is a massive problem in the city. So the Child Poverty Pathfinder team is very much a multidisciplinary team, but it is a real team. We actually co-locate in the council offices in Albion Street in Glasgow. Audrey of Money Matters is going to be speaking to you in a moment. She's co-located there. So that's third sector financial inclusion that are represented, as are GMAP, one of those organisations. And that's to help us redesign what that service looks like in the city. The Improvement Service represents Scottish Government on the group, and Scottish Government colleagues are actually co-located there as well. And it's been really useful for them to hear, from the operational perspective about what those challenges are. Employability colleagues are also co-located with us and are a key part of the team, as are colleagues in early learning and education. Housing colleagues are there, both at an operational level and at a strategic level, representing the registered social landlord sector. Glasgow Health and Social Care Partnership are obviously a key part of the programme because it is child poverty. Our strategic information, innovation and technology guys, which are also part of the Centre for Civic Innovation, they're the guys that look at the data science and then help us with the design on that. Glasgow Council for the Voluntary Sector are also co-located there, and they're helping us represent and link into that wider third sector, of which many of the organisations that are on the webinar today form part of. Glasgow Helps is the service delivery arm of the project, and Audrey's going to talk to you in a bit more detail about that service in a moment. So that's about the design and how we're going to do it and who's going to help us do it. But what's actually going to be done, we're just getting to the stages of that, and that's where we're getting into booster wards, using that data that's been available. That's got thresholds applied to it. It can show us families that are in deep poverty, families that are on the cusp of poverty, and they're called the booster wards. There are going to be 10 booster wards in the city, and we're just about to kick off work in 3 of those booster wards. One is in the Carlton, and that'll be led by our colleagues in Clyde Gateway, and that'll be focused primarily on employability supports, but they're already starting to look at ESOL and areas that are causing a challenge in that. Govan is another one of the booster wards. That's a predominantly focused employability service, and we're also already just kicked off in Southside Central. And the focus of that project is doing something different in terms of financial inclusion. So instead of crisis-led work in financial inclusion, we're looking at more financial capability, and that's led by Money Matters and GMAP for us. So you'll hopefully hear a lot more about these projects over the next few months if you're already operating in those community areas, and also the other booster wards that are due to come on over the next couple of months. So thank you for your time, and as the previous presenters have said, I'll be more than happy to take any more direct questions at the end or through the web chat, and I'll be sharing the presentation I've delivered today as well. So thank you for your time.
Thanks so much, Leslie. A huge amount of information covered there, which I hope people found really helpful. So thank you. Our next and last presentation this morning comes from two speakers, David Brownlee and Audrey Lang, who are going to provide information about financial inclusion services and how these are embedded in communities. David will speak first, and he's worked in advice in a variety of paid and voluntary roles in the Citizens Advice Bureau and independent advice for nearly 30 years, most recently with Citizens Advice Scotland as head of Bureau Services. He's now the financial inclusion lead for Scotland for Trussell. He joined the anti-poverty charity 3 years ago, as they also have a passion for delivering good, effective advice. Trussell's mission, as many of you will know, is to end the need for emergency food, and they support advice services throughout the UK to work with food banks, providing effective, holistic advice for those people that need it most. We also have Audrey, and Audrey, Audrey is the Chief Operating Officer. Found your bio, Audrey. Audrey is the Chief Operating Officer at Money Matters, Money Advice Centre, which is part of Glasgow's Advice and Information Network. Audrey is currently seconded as a financial inclusion lead to the Glasgow City Council Child Poverty Programme. Audrey has a background in the legal profession before setting up a new Citizens Advice Bureau in her hometown, and then she joined Money Matters at the start of 2016. Since then, Audrey's guided Money Matters through successive and successful Scotland National Standards for Information and Advice Providers Quality Mark audits, and holds the top level 3 accreditation. She's extended funding in several different directions, offering greater services for clients. As I say, she's currently seconded to the Glasgow City Council Child Poverty Programme. So I'll pass over to you now, first David, and then to Audrey. Thanks very much.
Yeah, thank you, Jill. Hello, I'm David Brownlee, Financial Inclusion Lead for Trussell in Scotland. We support 4 food banks throughout Glasgow, 41 in Scotland, and around 400 to 500 throughout the UK, and frankly, it's too many. We really want to see an end to the need for emergency food, and good advice and cash for support is at the heart of that, which is really why we're interested in what the work going on here is doing. We want to know more about what works, and we want to support how that can be helped to work better in Glasgow and also throughout the UK. So we've been working with Audrey to put in place a service really to help support Glasgow Helps and GAIN to work effectively together to ensure advice is integral to the support that Glasgow Helps can offer. And I'll pass over to Audrey to let you know more, because I simply supported the implementation of it. Audrey can tell you the details. Thank you.
Good morning, everyone. I'm not going to repeat that introduction, but I really am glad to be here. And I need you to think of everything I'm saying today. Think of cash first approaches as being at the heart of that. So I've got 3 things to talk about today. It will be a whistle-stop tour, and I've never done it this way before. David will tell you I could have 1 slide and do 25 minutes, no problem. I think today I do have about 20 odd slides just because of the 3 subject matters. So I'm going to finish what Leslie was saying about Glasgow Helps, then talk about the advice sector in Glasgow itself, and then add in the additionality that Trussell is bringing to the city with advice that complements the food bank offering. So let me just share this. Okay, can you guys see that? David, can you see that? Okay, thanks. Right. Okay, so Leslie was saying about the Glasgow Helps, and what it is, it was born out of necessity during COVID, when we didn't have as many red tape rules, and there was a great need for food, etc. Once COVID was over, it was felt that it was a service that should stay. It's now deeply embedded in the council's psyche for the citizens, and it really is, rather than a transactional, it's a relational offering to citizens and covers very many subjects that might be in their lives, much more than just money or food, but obviously including that. So there's a few phrases here that just talk about what it is they're trying to do. They want to look at empathy and care rather than just, saying to someone, what do you need? Let's get it done. And I think a listening ear is a lot in advice anyway, but this is taking it to another level. So the way they work, you can approach them in one of 4 ways. They have 3 levels of staff. The first level, the customer service, is more about you telling them within degree what. The next level is really why. And the holistic support officer, if you need that type of approach, will be a very long service of lots of contacts, lots of chances to discuss your situation, and it can be the actual doing it. You'll see that they are involving hundreds of contacts a week. They get referrals from maybe 90 organisations throughout the city, and they refer out to even more. So that was the start of making the city joined up, and to certainly fuel the campaign for No Wrong Door. The user feedback is incredibly positive, and people do like that there's been no sort of rush with their time. The Holistic Support Officer team have a very small caseload, which enables them to spend several months, if necessary, with clients just to seek out their concerns. So the 3 things I'm talking about do link up. I will come back to the advice sector's specific work with Glasgow Helps. But the advice sector in Glasgow is mainly GAIN, and they're made up of 8 citizens' advice bureaus, 4 independent agencies and 4 law centres. And they more than adequately cover the 3 administrative areas of Glasgow. So there's usually somebody in your local community that you can go to for good quality free advice. It is all about us being embedded though in communities, and I don't know if that's widely known, but in the city we are probably in something like 150 GP practices. We're in maybe 24 hospitals, through FISO, as Leslie said, over 30 schools. We're in housing associations to offer independent advice and all of the other things noted there, including the food banks. We've had to become a wee bit more flexible and change our offering. Again, that wasn't just our sector, that really came about in COVID, but it does mean that we now have a better choice of contacts for clients, and we will do what is right for that client. To give you an idea of the sector size, in 22-23 we had 28,000 clients, £45 million of gains, and we were covering debt of 36 million. And for a lot of our sector, people talk about income max, but what debt you're carrying and making that resolved so that you can face the way ahead is equally important. So the perception of the advice sector, including us, is that because we're so busy and there's not enough resource, we were always feeling we were dealing with the crisis and that we wanted to do more of early intervention and prevention. Now, we do have some upstream solutions via certain projects, but we do want to do more. So financially included is about getting gender-based violence situations, primarily for women, sorted where there's economic abuse. You can see that we go into psychiatric hospitals to get people settled in their homes, maybe even make sure that they have fuel available so that they're not having to stay in hospital longer. The impacts of those upstream interventions can be profound on people's lives. If it's stopping you from being evicted, getting you settled in your life and your mind, that you can concentrate on your job, get you out of debt, etc. So these upstream impacts are worthwhile, and we feel that we should do more of it. Our strengths were always that we were deep-rooted in our communities, and we offer the flexibility and delivery, and the sector has a deep knowledge. We use the core funding that we get from Glasgow and leverage additional funds for the city, and that is probably true throughout all of the third sector. So moving forward, just like the rest of the third sector, we're looking for stability of funding and longer levels. We do need more collaboration, and we want to stop having to fight with each other for funding. So again, that's the advice sector, but no doubt replicated through every third sector section. So we've started to reimagine advice, and that refers to Leslie's slide as financial inclusion being one of the work streams of the Child Poverty Pathfinder. And what we are looking for is that resilience, sustainability and transformation of the sector, of the public sector's view of advice, and those three things also pertain to clients individually. So in that change, we have to walk the walk. So we've embarked on a journey, and we've not just gone to other advice managers. We've held advice labs and actually had practitioners in to help design the service, because they see the people day to day, and some of us, you know, have drifted away from face-to-face contact. We've done it in areas so that we know what the current challenges of communities are. Leslie talked of the booster wards, and FI will be involved in them all, but the needs of Southside Central will be different than the needs of Carlton, and which will be different from the needs of Govan. So it is important to know the sector and the market and the people of the areas. And then it's about joining those dots with the bigger system in Glasgow. So advice, money makes the world go round, or what people say, but it is only one part of what is needed in a person's life. And poverty can be driven by a lot of other factors than just money. We do need to have more transformation through collaboration, and certainly Trussell is a good example of how that's already working. And our demonstration of change, the three that are coming up, will provide the first steps and evidence of the journey for us and the journey for clients. And as we move on to other booster wards, hopefully that can be refined. So on the third part, bringing Trussell into the mix, who have recently rebranded to Trussell, in case you're wondering. This first slide is just backing up what Jill said at the start, that it has been, unfortunately for them, a thriving industry, and that's really the reverse of what they want to do. It is all now about having dignity in cash first, and let's try and end food banks. But they've had a vision of financial inclusion in that. And their strategy is to put advice into food banks, etc., and make that available. And hopefully you are aware of that in the city, because as well as the project linked with Glasgow of the access to advice, there are two separate areas of the city that have access linked to food banks. Ourselves do the southwest, and there is a collaboration, I think, of 3 agencies that do the southeast. So that is already in place and is working well. Now, the background to the Access to Advice project is slightly different, because it's called PACS and it's about advice and cash. And there are 6 in Scotland. They're all very different, which is great, because it's also being evaluated so that we get robust evidence that Trussell can take to policymakers, etc. But the idea in the Glasgow one is that we are dealing with crisis advice. So ours is, if we get to someone quickly, that's an early intervention and prevention. It's also an excellent referral route if somebody truly is in crisis, because the actual queues for an appointment in Glasgow, the crisis would, well, it might not be gone, but it might have worsened with the time. So this is an excellent addition to the service in Glasgow. Glasgow helps take the referrals, and every single one of those referrals, they must pass to advice within 24 hours. and we must give the advice within 24 hours. And again, there are 7 agencies involved in this throughout the city, so you will get somebody based on your postcode and your local location. We've embedded lived experience in the offering, and I say embedded, you know, a lot of things with lived experience are taken as surveys at the end, but it's very important for this that it's at the beginning, the middle and the end, so that we can, you know, tweak things as we go along, depending on how it is working for the clients. And I just would remind you again, it's a cash-first approach. So although we want to work to end food banks, obviously if you present to advice in a crisis, we are dealing with that crisis. And if at that point that means a food parcel, then that's absolutely fine. We would be more than happy just to get you in a position where your need for food is lower. And hopefully this is the final slide. And it's just, I'll let you read it at your leisure when they send them out to you, but it's to highlight exactly what adding Glasgow helps to advice facilitated by Trussell Trust actually does. So the advice is in-depth but easier put in sections: benefits, debt advice, financial capability, etc. Glasgow Helps can mop up so many other areas of your life that will get you settled and able to be resilient for the future. And it's just not prescriptive. So whatever is revealed, there will be somebody in Glasgow that can be a warm handover, probably through no wrong door. And the bottom, as I've written there, is enhanced wellbeing for everybody. So thank you very much. I'll hand you back.
Thanks so much, Audrey and David, for what will have been extremely valuable information for many of our webinar viewers today. So I really appreciate your input.